Good morning, everyone. This morning, our talk is entitled Identity, Intersectionality, and Resilience, Providing Adolescent-Centered Care for Youth of Color. But oftentimes, I like to think of what else might I call my talk to emphasize the point I want to make. And in this case, it would be from the inside out. From the inside out. And you'll soon know why. I have no relevant disclosures, other than that, I have relevant financial relationships with young people. In fact, we all have relevant financial relationships with young people because there are material consequences attached to the extent to which our young people live up to the fullness of their potential. And in our collective society, that is a material consequence that we will all bear. There are several objectives to this talk. It's my hope that by the end of this session, you would each be able to discuss racial ethnic identity development as individual and intersectional processes. Second is to be able to discuss racial and ethnic stigma and its impact on identity development, lived experiences, and health. Third, to be able to describe a framework to explore with youth of color the influence of their group membership on their self-concept and lived experiences. And lastly, to be able to describe promising interventions and tools that we can use in clinical practice to promote resilience, to promote positive self-concept as part of an overall strategy to promote adaptive coping, resilience, and health equity. But before we begin, I want to emphasize and recognize that we are a room full of good people. We are good people who care passionately and who care fully about young people. And I care about how my words may or may not make you feel. I want to invite you to take a walk with me. It's a walk where you will be safe, and it's a walk where I will care for your feelings. And should you feel triggered, should you feel the need to react, hold it. Hold it. Suspend emotional reactivity, because otherwise we can't talk. These infants were born in the same hospital, at the same hour, on the same day. But they will experience very distinct realities because of the color of their skin. They will come to attach some level of color to their skin color. They will gain knowledge about how others view their group. They will learn about how societal penalties, stressors, rewards, and justice are distributed accordingly. The color of their skin will impact their health. The color of their skin will impact their life course. But first, I'd like to tell you about the story of this one infant. I was born in the Philippines to a family of Indian heritage, a group of 10,000 in what was then a country of 65 million. My family settled in the Philippines when the Philippines was the most promising place to be in Asia. Singapore was a marshland, and Hong Kong was a fishing village. And the Philippines had just come out of the Commonwealth era, a period that followed 300 years of Spanish occupation with the brief period of Japanese occupation during the Second World War. While I was reared growing up as a minority, I was always taught to ever be mindful that I was Sindhi, not just Indian, Sindhi. But under the chokehold of colonialism, I was raised to strive to be American. Not only was America about prosperity and opportunity, as a teenager, American teens also seemed to have all the fun. They had the youth culture of MTV, the sexual liberation of Porky's, and the adventures of Ferris Bueller. But I was also raised to be American, white American. Don't go under the sun or you'll get too black. I went to a private Jesuit school where we were not allowed to speak Tagalog outside of the one class where it was taught, outside of which we were fined a quarter for every non-English word we spoke. Despite our rich Hindu naming rituals that involve honoring our forebears and the alliance of stars, we all took on Western names to better navigate life in a westward-looking society. My father, Lachu, a name that stands for the analytical, the intellectual, and the hardworking, became Mike. And I, Vinod, a name that stands for joy, pleasure, happiness, and eccentricity, became Vinny. At the end of medical school, I looked to pursue residency training in America because in the US, in the Philippines, any US-trained physician can only be superior to anything that's locally raised. I could then go back to the Philippines and take care for the country's elite in a healthcare marketplace that is unencumbered by third-party payers and make myself an exceptional living. In 1996, I moved to Brooklyn before Brooklyn was cool to start my residency in pediatrics. And as a resident providing medical care to inner-city youth in Bedford-Stuyvesant, I learned about an America that I did not know existed. Bedford-Stuyvesant had been decimated by the crack cocaine epidemic and was a neighborhood of shuttered businesses, boarded houses, and absent parents. Caring for young people in Bedford-Stuyvesant with complex issues, I learned about what it meant to be a youth of color in America, caring for young people with complex problems of interpersonal violence, unintended pregnancy, substance abuse. I came to the US on a J-1 visa, one which would allow me to stay in the country for 7 years, after which I would have had to go back to my own country, not unless I found employment and served my time in a federally designated health professional shortage area. By the time I was ending my fellowship in Los Angeles, my time was almost up. Not only had I found myself in a subspecialty that did not exist in the Philippines, but my time and my space away from the dictates of culture and tradition also afforded me the space for my own identity search and to come to live my life as an out and proud gay man. Going back for me was not an option. In 2003, I took a position in Orlando, Florida, with Arnold Palmer Hospital for Children to lead their adolescent medicine program. Orlando Health and Arnold Palmer Hospital for Children just happened to sit on a medically underserved area because of the adjacent Paramore community which sat in its same census tract. I took a position which would afforded me a path to immigration and citizenship. Let's talk a little bit about Paramore, because Paramore and the care I delivered there for 14 years is so central to my story, and it's so central to my work around equity. Paramore is a 1.4 square mile community that was once the historic heart of the African American community in Orlando. With desegregation, the flight of upwardly mobile African Americans, and our collective failure to invest in communities of color, Paramore had fallen the same way many centers of urban African American life did, Detroit included. Interstate 4 was built right through Paramore, bisecting what was once a beating heart. Neighborhood schools were closed and children were bussed out. I met many grandmothers, and in the South, the front porch, there is a theme of the front porch, and the grandmothers would tell me, we lost our front porch. We used to be accountable for each other's children. We watched them from our front porch. So in Paramore, 73% of children lived in poverty, 84% in single-parent households, 47% with adults who neither had a high school diploma or a GED. The Paramore zip code had the highest rates of childhood abuse and neglect, teenage pregnancy, and juvenile arrests. You know, I liken adolescents to projectiles. On the basis of the headwinds and the tailwinds they face, you know where and how they will land. And the youth of Paramore were the young people that we had made poster children for everything wrong about young people. Instead of viewing them as in the midst of this critical developmental phase, the process and outcomes of which are the results of their interactions between them and their environment, instead of focusing on our collective responsibility as adults to secure for our youth the best possible environments for them to thrive and achieve their full potential, we obscured the promise of youth with demonized messages, with messages of reckless risk-taking. In my 12 years in Orlando, I had the privilege of partnering with the city of Orlando in a broad-based initiative to restore Paramore and to level the playing field for its children and youth, which was called the Paramore Kids Zone Project. And through Teen Express, we provided free medical, mental health, and case management services to Paramore's neediest and most underperforming schools, and they were overwhelmingly youth of color. Ironic, 6 years ago I finally became a citizen. Ironic that I should find my present position of privilege to their disadvantage. But one of my greatest joys in life has been being able to directly give back to the young people that made this American dream possible for me. to communities of color that put me where I am, because I kid you not, I would not be here if not for them. I consider my work then and my work now, which brings me here today, my act of citizenship. I have a debt to pay. I have a duty to discharge. Now, we all agree that social determinants are a legitimate cause of poor health outcomes and health disparities. But social determinants have structural determinants. Structures are the durable patterned arrangements that produce and maintain social inequalities and health disparities. And in the United States, race is a factor that bears profound structural impact. Nearly every key indicator across social sectors in the US shows a race outcomes gap. People of color are far worse off than their white counterparts across every age and income level in education, wealth, economic stability, health, and life expectancy. In the last several years, I've had the pleasure of serving on the Society for Adolescent Health and Medicine's Diversity Committee and being a part of the author group behind its position paper on racism, and how we call on providers to begin to explore identities, coping, and to begin to apply strategies from what we know, from promising practices, to promote positive self-concepts, to promote adaptive coping, to promote resilience, and ultimately to promote health equity. In the last several months, I also had the pleasure, by the way, of collaborating with Tammy Chang from the My Voice project, and you're going to learn more about My Voice this morning. So through My Voice, young people sound off on issues that matter to them in the present time through text message-based polls in ways that lift their voices and experiences to influence policy and practice so that we can make them more youth-friendly. So sometime around the middle of March, we sent out questions to young people about their race-related perspectives and experiences. And we received about 800 responses, actually over 800 responses. And we're in the process of sorting through that data. But I'd like to be able to present some of that today to put context to what we're doing here. As I speak about race, I acknowledge the problems inherent in categorizing complex experiences into small boxes. I have lumped all people of color and all whites in equally small boxes, although I am well aware of the vast diversity that exists within each of these simplistic categories. Neither do these small boxes adequately reflect the realities of multiracial youth or our immigrant community from various heritage groups that are far from homogeneous, and we are stratified amongst ourselves and in larger society. Race only minimally describes biologically or genetically distinct groups and is a social and political concept, not a scientific one. Examining the historical and legal construction of whiteness in the US, white people did not exist, much less as a label or a race, until the end of the 17th century, when the term white was constructed for social and political purposes to unite certain European groups that were fighting with each other at the same time that they were a numerical minority in comparison to the numbers of African slaves and Native American people. In order to justify the idea of a white race, every institution in this country is and was used to prove that race exists and that a racial hierarchy exists, with white people at the top, all other races in between, and the black race at the bottom. The concept of ethnicity, on the other hand, designates groups of people with shared and intergenerationally transmitted values, language, and traditions. And in this talk, I use the hyphenated term racial ethnic to reflect my belief that both race and ethnicity are critical components of how adolescents experience life, the kinds of messages that they give and receive, and ultimately what they view and see themselves as adults and their life trajectories. Racial and ethnic stigma refers to the inferior status, negative regard, and relative powerlessness that society collectively assigns to individuals and groups with non-dominant racial and ethnic attributes. Racism refers to the beliefs, attitudes, and actions resulting from categorizing individuals and groups based on phenotype, heritage, or culture, and that systematize and ensure an unequal distribution of privilege, resources, and power in favor of the dominant racial group and at the expense of all others. That's a mouthful, but it should be. Racism exists on 3 levels. Institutionalized racism refers to the differential access to goods, services, and opportunities in society according to one's membership in a stigmatized group. It is structural and normative. It is embedded in our institutions. It manifests itself as inherited disadvantage. The issue of health disparities affecting populations of color are not simply generic health differences. These are the result of the historic and present unequal distribution of social, economic, and environmental resources. Personally enacted racism results when prejudice or emotional bias and stereotypes, which are differential assumptions of others based on their being a member of a marginalized or stigmatized group, or cognitive bias, results in discrimination or behavioral bias. There is a cognitive, emotional, and a behavioral component, is what I'm trying to point out. Personally enacted racism can range from subtle daily microaggressions to threats to overt acts of hate and violence. They can be intentional and unintentional. They can be acts of omission or acts of commission, and they can be experienced directly, and they can be experienced vicariously. And the responses that we got from My Voice really point out like how their online and social media lives are platforms where young people just experience racism and live out racism, but also resist against racism. Racism, however, also manifests itself as implicit bias. Implicit bias is a mechanism of unconscious discrimination that operates beneath our level of consciousness. And more than 4 decades of research shows that implicit biases are very common among individuals, and they can coexist alongside deeply held personal beliefs to equity and can result in discriminatory behaviors. Looking at healthcare, for example, in 2015, there was this excellent article by Hall and colleagues it was a meta-analysis, and it showed that implicit bias exists in healthcare providers across different specialties, across different levels of training, and across different levels of experience, and it has been shown to negatively affect the patient experience. It affects clinicians' decisions as far as treatment and the choices they make, especially their prescribing practices around pain management, and it's also been shown to affect outcomes. But racism is also internalized, and I want to talk about internalized racism a little bit from the inside out. We haven't scratched from the inside out. Internalized racism is manifested in the acceptance by members of stigmatized groups about negative messages about their own abilities and intrinsic worth. This is not simply self-hatred or low self-esteem that everyone else is subject to, but this is a structure of self-defeating attitudes, beliefs, and behaviors that support and collude with racism. Just as there is a system in place that reinforces the power and expands the privilege of white people, there is a system in place that actively discourages and undermines people and communities of color, leaving them to mire in their own oppression. In internalized racism, self-concept is limited, self-esteem is corrupted, self-image is negated, and self-love is defeated. It manifests itself in a sense of inferiority, in being grounded in victimhood, in failing to take responsibility for a situation, or feeling like one can be an agent of change. It is in focusing on doubting and reading and trying to strive for white acceptance, leaving us with less energy, time, and resources to focus on our self-development. It is seen in projecting our own sense of inferiority and inadequacy onto others, resulting in a failure and a lack of confidence and the inability to support our own people in their ability to lead and in our ability to lead ourselves. It is acceding to the system in place that rewards people of color who support the dominant order and coerces and punishes those who do not. Yes, it includes being called the black person in the room. Internalized, personally enacted, and institutionalized. These dimensions reflect how stigma potentially impacts one's identity development, lived experiences, and life trajectories. Now, identity development is a fundamental task of adolescence, and racial and ethnic identities are key components of adolescent social identities. Racial and ethnic identity is a multidimensional construct that includes dimensions of the importance of race to my self-definition, the importance of race at this particular point in time, beliefs about how others view me, my beliefs about how I view myself, and my beliefs about how I should behave as a group member. And young people develop their identities through a process that begins typically with a pre-encounter stage where they begin with the relative state of unawareness about what it means to be a member of their racial ethnic group. Following a positive or negative encounter, however, that serves as a trigger, they then are compelled to examine the role of race and ethnicity in their life and in society. They immerse themselves into their communities, after which they come to learn who they are as racial ethnic beings, as racial ethnic bodies, and integrate this racial and ethnic identity into their holistic self-image. There's beautiful work around the fluidity of racial ethnic identity, that this is not stagnant, because young people have to configure and reconfigure their racial and ethnic identities as they enter new environments. They have to learn how to navigate a new set of racial ethnic dynamics. The concept of intersectionality, however, also highlights how our multiple social identities are not merely additive, but they create intricate interactions that, under a broad range of social and ecological influences, affect outcomes. Take the example of LGBTQ+ youth. We talk about immersion into your communities of origin as being central to the development of one's racial ethnic identity. But such immersion can be difficult for LGBTQ+ youth because of heterosexism, machismo, and homophobia in their communities of origin. Racism shapes the lived experiences of youth of color. We asked youth, have you experienced or witnessed racism? Yes, I've had people call me racial slurs. In elementary school, I got jumped for being Asian. I'm multiracial, so I've received racism from a lot. Black people won't accept me because I have white people assets, and white people won't accept me because I look black. They experience it vicariously. My father is black, and I have seen him experience racism. But racism also shapes the lived experiences of white peers who care about youth of color. From an 18-year-old white female, I grew up around people of color and witnessed them go through a lot, being singled out, getting in trouble in school for no reason. From a 17-year-old white female, my teacher made fun of my Muslim friend by calling her a terrorist and say, look, the Arab is angry, watch out. Personally enacted racism is also not a simple white and color phenomenon because youth of color also emulate the discriminatory behaviors that many in their group experience. From a 16-year-old white male, I've had people threaten me because I'm white and I was in the wrong part of the city. In the My Voice data, there certainly was this theme of anti-white bias, as well as racism, enacted by youth of color against other youth of color. Because you know why? Because hurt people hurt people. Hurt people hurt people. And one of the lessons I got from the My Voice project so far, and I'm here talking to you about how we should approach the issue of race and ethnicity and belonging with people of color and youth of color, is we should be talking about this with all youth, don't you think? With all youth. With all youth. Racism has the potential to negatively affect health and well-being through several pathways. First is the restricted access to social resources and/or increased exposure to risk factors. This refers to differential access to material needs such as housing, nutrition, employment, healthcare, and also the increased likelihood to exposure to environmental toxins and health hazards. Think Flint, Michigan. It also exerts adverse effects on psychological and physiological functioning. Racism has been shown to not only affect physiology like cardiovascular reactivity, but can also result in symptoms of emotional distress, hopelessness, anxiety, depression. Allostatic load, which is the wear and tear on the body that accumulates as an individual is exposed to toxic and chronic stress. Racism is trauma and toxic stress. The adverse effects of health racism does not appear to be because of singular acts of racism, but how young people and how we have to contend and be prepared to contend with everyday racism. And that sense of preparation, that sense of vigilance is definitely not good on the body. The reduced uptake of healthy behaviors, such as exercise, and or increased adoption of unhealthy behaviors, such as substance use, either directly as stress coping or indirectly because of reduced self-regulation. And lastly, direct physical injury caused by racist violence. Now I want to provide you with a framework for how we approach this work with youth. This is where the inside out comes in. I want to focus on how we show up. How we show up and the framework under which and within which we have these conversations with young people. And I want to talk about an approach that is culturally humble, trauma-informed, and strength-based. 3 factors guide practitioners towards cultural humility. And these factors reflect internal, interpersonal, and institutional dimensions from the inside out. The first aspect of cultural humility is a lifelong commitment to evaluation and self-critique. We never arrive at a point when we are done learning, and we must desire to learn more, especially as it pertains to the identities and lived experiences of others, one youth at a time. Youth of color come from a wide variety of backgrounds that affects their experiences and their identity development and their perspectives. To a young person, race can mean anything from nothing to everything. From a 19-year-old Asian male on the role of race in his life, not much, I just ignore it. From a 20-year-old Latinx female, well, I'm a pretty light-skinned Latina, and I have 0 accent, and I'm generally ethnically ambiguous. So it doesn't personally affect me too much, other than the microaggression or two when I have a good tan going. From a 21-year-old black female, I am black all the time. It's also critically important that we guard against imposing our own worldviews, especially where we might ourselves be providers of color with our own set of lived experiences and who have had to navigate our own processes. The task is to open-endedly explore these constructs with youth. The second aspect of cultural humility, a desire to fix power imbalances where none ought to exist, is critical. When we interview patients, we are experts in a body of knowledge, but our patients are the experts at their lives and their symptoms and in their strengths. You know, in my practice, I very often speak about power. I talk about power with young people in the room, especially when they're deferential and I try to engage them in decision making and they were like, oh no, whatever. Or who do you want to be with you in the room? Or do you want your examination to include a chest exam? Because if you're confident in your self-exam skills and your dysphoria, I'm not going to do it. But you have a voice. I speak about power. And part of cultural humility is being mindful to power. So what does this mean for us? What does this mean for us providers of color and for our white allies and co-conspirators? First, how are we going to show up? We have to show up woke. How else can we walk with them to wokeness? And if I have to frame it as a challenge, I can't let you be more woke than me. I have to be at least as woke as you are, right? But for us to do that, we have to see racism as not just individual acts of meanness, but where it lives in our subconscious as implicit bias and in the structures and systems that feed internalized racism and confer dominance to whiteness. What does this mean? What does this inside-out work mean? First, we must address implicit bias. I do not have enough time today to talk about implicit bias, but in your resources, I've given you a lot that you can start out with. Research shows that implicit bias is malleable with time, intention, and attention. In your resources, you will find self-assessments like the Implicit Association Test. You'll also find resources from the Perspective Institute, which talks about strategies to dismantle implicit bias. When a stereotype is triggered, you call it. In our society, there are stereotypes of black people being less intelligent than others. When triggered, purposely think of a black person who you know is undoubtedly smart. getting to know the other person beyond who they are as a member of their own group, putting yourself in the other person's shoes, which increases your feelings of psychological closeness, making you less likely to act on the basis of stereotypes. If you are so moved, do your internal work, and I've showed you where to go. From the inside out, what does this mean for our providers of color? Dismantling internalized racism proceeds from the inside out. If we are to critically work with youth, we have to examine and dismantle our own internalized racism and examine how we as hurt people. In my own self-development, I have had to work to decolonize my mind. I speak about colonization because colonization is the other ugly head of racism. I have had to work to decolonize my mind. There was a time when I would be asked for my biographical sketch because I was giving a talk, and I would strike mention of where I attended medical school, because I knew that people would make assumptions about me and my ability because of my school of matriculation and my country of origin, regardless of my service to young people in this country. Today, I'm here in front of you not in a suit or a jacket, as you might expect, but in a barong Tagalog, as a tribute to indigenous Filipino culture, that they can loom, hand-dye, embroider, and craft an object of beauty out of a humble pineapple. That's how you deconstruct internalized racism. Young people, I see a lot of young people of color in the room. Guys, let this be my gift to you. This is my prayer for you. Discover your strength. Deconstructed internalized racism is Toni Morrison saying, I write for black people, and I don't have to apologize. Tolstoy didn't write for me. This is powerful stuff. When you tap into it, when you find it, it will change your North Star. It invalidates a whole set of values by which we judge ourselves and others. What does this mean for our white colleagues? First of all, let no hurt come between us because we belong to each other. Let no hurt come between us. But we have to undo the habits of harm that we have inherited from our ancestors. These are habits of racial harm. How are you going to show up? First, you have to critically examine the privilege conferred by whiteness. Racial socialization for white people is largely based on colorblind approaches and unexamined whiteness. White people are socialized to be good people, and if I am a good person, I cannot participate in racism. When viewing a social problem from an unexamined individual lens, what is often not seen are the systemic policies, norms, and practices that maintain the power structure of racial dominance and subordination. If a traffic cop pulls you over, you can be sure that you haven't been singled out because of your race. If you seek legal or medical help, you can be sure that your race will not work against you. The task for our white brothers and sisters and non-binaries is to develop a positive white and other than white identity. What else are you? What are you? What dimensions of your identity do you hold dear and self-defining, and what are their associated values and traditions? Show up with them. I will show up with mine, and you will show up with yours, and we will be equal. No cloak of color. We will be equal. And it's pretty easy to settle an argument that one culture is superior to the other. From youth, I'm proud to be Polish. I am white with a strong Italian heritage. I love our family traditions and values. Racism is what made my grandparents from Italy ethnic whites. The internal to the interpersonal. This is how we move from colorblindness to co-conspiracy. This is what moved the freedom riders across social divides to ride to the Deep South in 1961 to protest segregation in our bus terminals. You know, in our poll, white youth clearly had varying relationships with the construct of privilege. From a 14-year-old white female, I'm white, so I have to acknowledge my inherent privilege and make space for others. In the words of a 19-year-old non-binary, it allows me to move with the world with ease, and I get benefits that I didn't do anything to deserve. From a 19-year-old white male, we're considered to have privilege and sometimes made out to be evil, that we are majority and racist, spoiled white supremacists. Privilege has been weaponized. That word privilege has been weaponized. We have to advocate for racial justice without causing harm and hate internally and externally. Our goal is racial harmony and to upend habits of racial harm. We cannot allow the worst of each other to define each other, much like we cannot allow what society might otherwise regard as the worst of youth to define all youth. May we never forget that kindness is the water of humanity. And without water, we harden. And kindness is an aspiration, it is an attitude, it is a practice. Youth need the context and the critical consciousness to understand privilege from a historical to present-day context, and to understand and dismantle internalized racism. This article in the New York Times from last week shows the fight that's going on for the values that are at heart of our social studies learning standards as a part of an effort to shape the next generation of voters. Ms. DeVos, schools should be the place where we teach our young people social competence and critical consciousness. We participate as a collective in the socialization of young people, parents, schools, peers, after-school programs, healthcare. We learned this in our work in the sexual and reproductive health movement. It's very difficult to teach a sex-positive approach in an abstinence-only school district. We have to speak the same language. We have to reflect the same principles. And we have to do this as a collective. I'm talking about how we do this in our part as in healthcare, but we also need to think about how we more broadly do this. We need approaches that are trauma-informed. Third aspect of cultural humility is aspiring to develop partnerships with people and groups who advocate for others. While we as individuals can create positive change, we are stronger together. We must advocate for youth of color and communities of color in our schools, in our health systems, in our courtrooms, in our boardrooms, where the struggle for equality is far from over. This framework also requires trauma-informed approaches. When a human service program takes a step to become trauma-informed, every part of its service delivery system is examined and modified to reflect a basic understanding of trauma in the lives of users. And it's modified to reflect this understanding and to promote healing and resilience and prevent re-traumatization. How do we apply the principles of trauma-informed care to the care of youth of color from the inside out? We need to ensure safe clinical spaces for youth, display posters and materials with positive images of diverse youth in our common spaces, to develop and enforce anti-discrimination policies in our clinics, to make sure that our staff reflects the diversity of the youth we serve, to reflect and demonstrate a commitment to inclusion and equity in recruitment and hiring. We need people of color at the top and at all levels of our organization, but especially at the top where they had long been missing, from where they can be role models to the youth we serve. We need to utilize peer-led models of care which have been shown to improve self-esteem and mastery and help young people to develop leadership skills that promote independence and self-sufficiency. But being trauma-informed also means maintaining respect and recognizing historical trauma. That massive trauma that communities of color and groups have experienced over the lifespan and across generations, from 250 years of slavery to 90 years of Jim Crow to 60 years of separate but equal. From the repatriation of almost 2 million Mexican Americans to the 1930s, to the continued use of police force on black and brown bodies, to the caging of colored children in our southern border. Strength-based. Much of the prevailing research on people of color is focused on victimization, hardship, negatives, and their subsequent impact and negative impact on social, physical, and emotional health outcomes. Yes, it's important to document these because it can clue us in on the kinds of solutions and interventions that we might employ to improve life experiences and outcomes for the group. But it's critically important that we also focus on the resilience that's demonstrated by many people of color and their strengths and assets as individuals, as families, and as communities. What does that mean? That also means managing and being mindful of our message. In 2008, we were part of a robust initiative to address obesity in the Paramore community. It was this broad-based initiative to really tackle obesity from a socio-ecological framework. We had the city's Parks and Recreation Department with us to address parks and the built environment. We had public and private partnerships, and we happened to get a grant from the American Academy of Pediatrics to bring healthy lifestyle classes and cooking classes to the community. We were so thrilled that the Orlando Sentinel wanted to interview us and do a story. The story, new program targets poor, overweight kids. I had to deal with more than one upset parent. Get youth feedback. In Phoenix, at Phoenix Children's Hospital, we have a program, we have a mobile health program, much like I ran previously, and we work with young people experiencing homelessness and families and, those that are just dispossessed. And every Tuesday, we park our mobile unit at this one site. One day, this elderly gentleman came up and he brought this couple with him and they introduced themselves as husband and wife. And he said, every Tuesday, I have to stare down my window and look at that image in your mobile unit that tells us that we come from broken families and that fathers are absent. And here's a married couple. And I had to profoundly apologize. I wasn't there when they wrapped that mobile unit. My only assumption is who takes children to their health visits? Mothers. But being sensitive to how others might view it, right? When you take a look at how we market and message our services around PrEP, pregnancy testing, and getting tested, there is a fine line. There is a line between marketing savvy, representation, and stigmatization. And we have to think about that. While once part of my vernacular, right? How do we describe the youth we work with when we write grants, when we plea for funding? We work with at-risk youth. At risk for what? Aren't we all at risk for something? Every time I get into my car, I'm at risk for getting into a crash. Vulnerable youth. Vulnerable to what? Vulnerable to structural violence. The process by which institutions actively cause harm to individuals by preventing them from accessing the resources and opportunities that they need to thrive, if not survive, because of their location in the social world. Be mindful. So how do we explore identities? What kind of language do we use? I'm such a student of language. Because language is personal, language is individual. This here, by the way, is a script that comes from the literature that talks about how you can explore identities and meaning with young people. Who are you? I ask young people, right? And you'll find this in your handouts. So in my case, I ask young people, I'm like, so tell me about who you are and what dimensions of your identity are really important to you. Sometimes, when they have a little bit of difficulty, I lead. I'm a brown, gay, cisgender, agnostic male. Sometimes I'm asked, Dr. Chulani, aren't you crossing boundaries by telling them who you are? I'm like, isn't that exactly what I'm telling them to do? And shouldn't that be my conflict of interest disclosure? That as your provider, this is the lens with which I see my world? I ask for permission. Is it okay if we talk about your experiences as a racial being? because I'm really curious about this, and I want to learn from you. In fact, I might even use what you teach me to teach others. Permission. You don't have to answer anything you don't want to answer. But you know, youth can be very eloquent in describing their experiences. For my 20-year-old black non-binary person, I hate it. I feel most comfortable and safest when I'm surrounded by other people my race, but they think I'm racist. But that's just because I like to date outside my race. For my 20-year-old Hispanic transgender male, it's not even the trans thing, because I pass really well. It's just that at work, and he works at a hardware store, they think I'm stealing. I'm like, dude, I work here. How do youth cope with racism? I can present you, so we asked youth, by the way, how do you and others cope with racism? Responses included, not sure, ignore it, walk away, get used to it, vent online or to friends, talk about it and find people who understand and can help, use them as motivation for healing and teaching, create a comeback, fight the stereotype, be strong and prove them wrong by being better, speak up against it, get educated with the facts to correct others' wrong beliefs, protest, activism. I can present you with a complicated taxonomy of coping strategies from the psychological research literature, and that exists. Accommodation, approach. But really, how useful is that in clinical practice? Our task in clinical practice is to get to know youth's identities, their experiences, the meaning, and how they are coping, and ultimately, to assess whether that coping is 1, adaptive, 2, effective, 3, adequate. Adaptive, effective, and adequate. Now, it's also important to recognize that different types of coping may be needed at different points in time. In anticipation of an exposure, following an exposure, when dealing with the likelihood of a potentially recurring or persistent exposure. Consequently, one of the most pressing challenges for young people is the need to develop a broad range of coping responses that will allow them to respond to different types of situations with appropriate and effective strategies, and to be able to, when in the moment, choose which of these strategies might be most effective. When do I walk away and when do I engage? It requires cognitive flexibility. In fact, it's been called coping flexibility. The greater the likelihood that young people experience their coping capacity as inadequate, the more likely that episode, a recurring episode of race and ethnicity-related maltreatment is going to be experienced as a chronic stressor. So how do we respond to youth experiences of racism? I'm trying to be mindful of time, and I know I need to chill. We'll be okay. We'll be okay. So how do we respond to youth experiences of racism? You know what my problem with us is? We're interventionists. We like to tinker and tool. First, we have to actively listen. You haven't even listened and you want to act already? Listen. Intentionally listen. Be present. Listen. Listen. Shh. Right? And when you respond, this is what the literature tells us about strategies. Validate, externalize blame, create a positive self-concept, teach about culturally responsive social support. Once you have listened, if you are so moved, you've taken a look at what the professional consensus is. When you act, there are 3 things I want you to remember. 3 things. 1 is to demonstrate an unwavering commitment to youth participatory and community-based participatory approaches. That we do this with young people. 2nd is that we pay attention to rigorous development, implementation, and evaluation processes, because we do not have the body of science for what works and what doesn't. What we have stands on promising practices and professional consensus recommendations. And the fact that we do not know what works and what doesn't is reflective of institutional racism. For as long as this has been a problem, we haven't taken the step to address it. The third thing that you must bear in mind as you think about how you respond is to think about how you integrate promising strategies. And I want to go over quickly just a few promising strategies. Specific messages of racial socialization. Racial socialization is the process by which society transmits messages to youth about the significance of their race and ethnicity and their associated values and norms. And researchers have distinguished that parents, so they focus a lot on the role of parents in racial socialization as the central node in the lives of many children and young people. And the messages that parents give their children about this vary. They include how I prepare my child to deal with bias, equality, you're a good child and you're all equal, promotion of mistrust, cautions about other groups. But of all these messages that teach young people ethnic pride, history, heritage, and positive concepts definitely stand out. Messages of cultural socialization have consistently been associated concurrently and longitudinally with more favorable adjustment, resulting in higher self-esteem and better outcomes for youth. There's been a proliferation of racial and ethnic socialization resources. The American Psychological Association has a project called Resilience, RES, standing for Racial Ethnic Socialization. HealthyChildren.org also has materials about how we can engage parents to work with their children about how to talk about bias and how to use current events to help foster critical consciousness with children. Fostering supports. Social support has been defined as the availability and presence of support networks that can provide care, concern, love, and coping support. In the African American community, this has been often referred to as leaning on others. In our work with young people, we can foster supports because young people can then connect with groups that are like them and they can share their experiences and they can learn from others about how they cope. And being connected with one's group can ameliorate feelings of ostracism from other groups. Encouraging and promote self-care. For youth experiencing racial and ethnic trauma, and in our work as clinicians and social justice advocates, self-care is a restorative necessity. In the words of Audre Lorde, caring for myself is not self-indulgence. It is self-preservation and it is an act of political warfare. There's a lot of promise in the field of mindfulness, and there's this great book, Mindful of Race. In your handout, I've provided you with resources on mindfulness and how mindfulness can be a way for us to deal with our distress and sit with it in the moment. Nothing in life is personal, perfect, or permanent. How can I deal with my hurt right now so that I can experience a freedom that does not depend on my outside circumstances being different? This internal freedom is the freedom that Nelson Mandela talked about during the 27 years that he was incarcerated. There is also promise in the field of mindfulness as a way for people of color and white people to come together and suspend emotional reactivity, because it's difficult to talk about race. We get defensive, we get angry, as a way for us to come together, foster self-insight, and facilitate effective cross-racial communication as a way to build strategies, the interpersonal, so that we can then work on the institutional. We are multidimensional beings whose lives, so by the way, this Inside Out, this is the heart model, and it just came out, about a month ago. And it shows really what I'm talking about. How we can work with youth to address their experiences and provide them with immediate relief from racial ethnic trauma. How we can acknowledge, support, and help them cope. How we can build their strengths and connect them with others and prepare them for liberation and resistance, because liberation proceeds from the inside out. Taking intersectionality, we are multidimensional beings whose lives reflect the intersections of gender, race, ethnicity, gender identity, sexual orientation, national origin, immigration status, class, and religion. When we asked youth if and how they experienced racism through the My Voice project, they said no. For the most part, people could care less, but there is homophobia and transphobia in my school. No, but I've experienced anti-Semitism. Yes, from white liberals. They say that if you're a Hispanic conservative, you are a traitor to your race. Taking intersectionality seriously means that all of us who participate in the socialization of our youth, parents, clinicians, schools, churches, advocates join because we can't do it alone, but we can each do our part to ensure that our youth are fully equipped with the tools to be self-reflective, critically conscious, socially curious, interpersonally courageous, and self-assured despite where they have been positioned in our society. That they are able to effectively negotiate their multiple identities and remain resilient in the face of our many internal, interpersonal, and institutional isms. That they can connect across differences in ways that are honest, fair, caring, authentic, and compassionate. That they can live harmoniously in our increasingly diverse society. Youth need the tools to break down the social divisions that they have inherited growing up in this nation. But there is hope. When we asked My Voice youth, how do you think people your age can deal with racism and negative experiences? They said, we can learn to grow together, foster a mindset of acceptance of others, promote positive messages, and embrace our identities. Starting open discussions is important for helping people to bridge gaps and see everyone as human beings. This one is particularly beautiful. I think that my generation is particularly well equipped to handle the problems left to us by previous generations, and we will have a better ability to handle social problems. We can work with them as equals. In our role as social justice advocates, it's also critically important to consider that just as forms of oppression and subordination are interrelated, intersectional violence, so is justice. Rather than single-axis vertical approaches of #MeToo, Black Lives Matter, Brown Lives Matter, Trans Lives Matter, we should hold that we are multidimensional beings and learn how we are affected by multiple systems of oppression and strive for horizontal approaches where all lives matter. For all of us, youth, people who care about youth, and people who care for youth, dismantling what hurts and divides us proceeds from the inside out. We must attend to the internal, cultivate the interpersonal, confront the institutional, and bridge the intersectional. Thank you.